I'm going to just let you do it, and I'll just be there at the end.
Are we good? Are we going? Okay, cool. Welcome, everybody. We are doing a personal service session, a little feedback session and updates today for the next 45 minutes. Welcome back to those of you who have been here before. Some of this will be review, but I know we have new people kind of joining every week. So I'm going to go over what might feel like a little bit of a review for some of you who've been here previously, but I want to make sure the new folks get pointed to things and know where to go as well. So thank you for coming back, or welcome. What we're going to go over today is we're going to review some face covering information. We're going to review what the Safe at Home order is, where it's coming from, where you can find more information on it. We are going to try to answer some of the most commonly or most frequently asked questions and answers we've gotten at least over the last week or two to clarify what might be confusing or just what seems to be the most common issues for businesses at this point that fall within this group. And then we're going to review resources that are available to all of you in the personal services sector. I know this industry or this sector is huge. And so I haven't condensed the list yet. I know some of my peers have been condensing their list in their webinars, but really I thought it would be nice just to review the definition of what personal services is to help you find yourself in here. But it's really those services and products that are not necessary to maintain an individual's health or safety, or the sanitation or essential operation of a business or residence, whose work requires the professionals, to be less than 6 feet from a person from whom they're providing the services. So you all have been kind of given that green light to get closer than 6 feet when you need to perform your service. But as soon as the services are done, the general building or the general operation or the rest of the folks within the building need to try to maintain that 6 feet distance as much as possible. I know this is being recorded, so you can go back and look, but of the allowable services on the right side, these are all listed on the state's Safe at Home website, as well as DORA's updates on the DORA state website. So I'm just going to quickly scan through them. On the left side is here, it's just a continued list of available services. On the left side here is just a little bit more details about what specific treatments might be allowed, where for some of you, not every single service you would have been providing before is going to work right now, so you might need to limit which services are available. And the next slide is just to reiterate what is not allowed yet that might fall within this industry normally. So that's on the left, and again with a few details of specific services spelled out on the right. So I know we kind of went through that quickly, but you can hopefully go back and look at it later. And again, I'll show you where all of these lists are at the end of the webinar when we review resources. Again, here's the review for some of you, but I think for businesses or for everybody in general, we need to kind of take a long-term outlook when we're trying to kind of figure out what our new normal or next normal is going to look like for a while. The Safer at Home order is going to stay in place for, we don't know how long at this point, but really the things that the metrics the state is looking at is the vaccine, which isn't going to probably be available for a while. How treatment is going, is there enough capacity within our medical system to provide the level of treatment required, and immunity. So until there's a vaccine or treatment or herd immunity that really keeps our healthcare system from being at a critical kind of crash point, we're going to be in the Safer at Home order of some kind, even though we expect there'll be adjustments along the way. Like you said, it's going to evolve, and I think looking at this as it's going to likely take months, multiple months, to possibly even consider being out of the Safer at Home. I think that's better than expecting it to be at the end of this month or in a few weeks, though we don't know here at Boulder County Public Health when those orders are going to change significantly. So we're all kind of waiting for information at the same time. Locally, I wanted to review the face covering order. So in Boulder County, we do have a local face covering order that says if you're outside of your home and you are less than 6 feet from someone, you need to wear a mask. that mimics, or that's very similar to what the governor has been saying as a state, is wear a mask at all times if possible. The few situations where people might not wear a mask is if it's not safe, and kind of the safety reasons might be, you know, they're high up in a tree and they need to be able to kind of work around it, or they're alone and so they don't need to wear one. Medical exemptions might be another reason why someone doesn't wear one. I know anyone under the age of 2 is not allowed. If you can't remove the mask yourself, you are allowed to take not wear one. And just to clarify medical exemptions, if someone walks into your business and says they can't wear a mask for a medical reason, you don't have to ask them why. You don't need to dig into that. You just sort of need to accept it as is. You don't have to have them verify for any reason. But in general, you are required in personal services to have anybody who is receiving services, as well as the staff, does need to have a mask, and we'll go over that in a little bit more detail here too. But locally, I know there's been some confusion around the children under 12. So even though there is a local order that says when you're out of your house, kids under 12 don't need to wear a mask, for if they're coming in to receive services from you, they still need to have a mask on. So I think general best practice is to probably encourage if your parents or have kids, have a mask available, because when you're out in public, there might be certain situations where the kids don't need to wear it. But as soon as you go into businesses, some of those businesses might require masks. So make sure those masks are available. Even this order does not supersede any stricter orders. So there are situations where kids under 12 are going to have to wear a mask. So keep that in mind. So the Safer at Home order is really just the state's order. I know it can get confusing between what's a local order, what's Boulder Public County Health's orders, or what's a state order. So Safer at Home is really the state guidelines. So anytime you hear Safer at Home, just consider that that is the sort of the guidelines we're all following at this point, which is saying continue to stay at home as much as possible. We really are still in some sense hoping most people follow the stay-at-home guidelines as much as possible. As the less we're out there interacting with each other, the safer it's going to be, and the better our transmission rates are going to be, since the virus itself is still just as contagious as it's always been. Even though businesses are allowed to open right now with restrictions, we still hope that most people stay at home whenever it's whenever it's not a necessary trip. Even though, like for you all, you have been given sort of that exception or permitted to be able to get closer to folks. And I know there's a wide variety of comfort level within this, and employees and business owners and managers are kind of all over and at different levels. So that's where our team is here to kind of help you as individuals and as groups kind of walk through some of those questions as we have the capacity to. In general, what personal services can do within the Safer at Home order is that you really need to wear that personal protective equipment at all times. Gloves has been a tricky category for the last few weeks of trying to understand, so who can do what. I think the best recommendation we have at this point, because we don't have specific business type by business type guidance, is that staff, you should follow your OSHA standards or whatever your industry standard guidelines are, and go with what is the most protective order or most protective guidance at that point. But in general, the state's order says you need to wear gloves whenever possible, unless it is prohibitive to providing that service. Mask is a little bit of a different situation. It is required for everyone, whether you're a staff or clientele. It cannot be removed. So if someone is asking to remove a mask or would like it to be removed to have a specific service done, that is not allowed. Homemade masks are fine for clients. Like I said, masks might be slightly different for employees or staff if that industry standard requires you to. I think that's one of the biggest difference between some of the services that overlaps between limited healthcare settings and personal services settings, is that chiropractors might fall into both or one or the other, or massage therapists might fall into both categories. In personal services, you do not need to wear a surgical or medical grade mask, but in limited healthcare settings, you might need to. So that's one of the big differences of how to think about it. You are allowed to perform the services It's not saying that you can't do it, whether you're in the limited healthcare service or sector or the personal services. Those types of massage or chiropractic work, that is allowed. It just kind of depends on what rules you need to follow. So for some physical sites, you might need to be looking at both sets of guidelines, kind of depending on what the nature of your facility or business is like. Another thing to think about is there's been a lot of questions over the last few weeks about social distancing. And I think the big thing to keep in mind is it's really about the people we're trying to social distance. For those of you who are working with animals and pets, that's not quite as critical as keeping the people separated from one another. And that there's very clear guidelines on how to require or how to clean and sanitize your spaces. So you want to make sure you're really looking at what's needed there and laid out in the requirements. And that in general, or everybody needs to consider how are they going to make vulnerable population accommodations. And some of the ideas that have come out might be specific appointment times or certain hours during the day, but consider how you're going to meet that need, as that is a requirement for all of you. And to help you with knowing what all of the requirements are within the stay-at-home guidance is Boulder County Public Health, or the staff here, is we've compiled a checklist that is available on our website. I'll show you in just a second. You don't have to use the checklist, but we've put what is required and mandated for you to stay in compliance with the state, as that is a mandatory must. These are all the mandatory must-dos for you to open. We've compiled them into these checklists that you can use if you would like. We hope they will help you as a compliance aid, and that you will use them as a communication tool, not only with your staff, but with the public, of why you're doing what you're doing. And Corinne is going to kindly show you a lot of the posters that have been developed that you can use to communicate with the public and your staff of how you're being compliant with these checklists. So I'm going to see if this link works here to show you where you can find these checklists. Okay, I'm going to have to leave the site here for just a second. So if you go to, let me see. Can you see my screen? Can you still see? Okay, so if you go to bouldercounty.org, just the main website here at bouldercounty.org, you'll see at the top of every single page, there's going to be these 3 bars that are red and blue. Right smack dab in the middle, you'll see COVID-19. If you click on COVID-19, it's going to take you directly to Boulder County Public Health webpage, where all the coronavirus COVID-19 information is. If you scroll down the page a little bit, there might be a lot of information that will be of interest to you. But the guidance that we prepared specifically for businesses is, if you come down to this little green, I guess, table, you can click under this category that says Guidance for Boulder County Safer at Home. And down a little bit, you'll see that there is a number of checklists for each of the services fields that the state has already provided guidance on. Not every field is now available. Oops, let me go back one. I opened the wrong one. So for personal services, this is what the checklist looks like. So I wanted to show you so you could, when you find it, you know you're looking at the right thing. But within this document, we have pulled off from the state, off their websites, all of the requirements for personal services that have to do with the workspace. There's workspace requirements. There are employee requirements, which you can see here. And then there are requirements for what you need to do to keep the customer safe. All of those are in one document, as well as, if you keep scrolling down, there are general requirements for every single business, regardless of what sector you're in. And again, it's broken into the same 3 categories of workplace requirements, employee requirements, as well as how to keep the customer safe. So we have put all of these in one place for you, as hoping that you will use these sort of elective checklists to help you know if you're compliant or ready to open. So that's one resource I wanted to show you. That's on our Boulder County. And I'm going to come up here and show you all of this information is coming from the state's website, where if you can go to colorado.gov safer at home, this is what it looks like. So I wanted to show you so you could at least recognize if you're in the right place. If you come down to, on the left side, they have some drop-down menus, but under Safer at Home, you're gonna see a bunch of links for all the different sector types that they have guidance out on. You will, it's in alphabetical order. If you scroll all the way down, you'll find personal services. This is what your guidance page looks like. A lot of you are familiar with this. But again, this is here where it has the workspaces, the employees, and the client and customer information. This is what we have taken and put on the checklist, as well as all of the general guidelines. So just wanted to show you how you find information. A couple other things I wanted to point out is a lot of common questions have come up about symptom screenings. That's also over here on this left-hand side, but they have a great how to run them symptom screenings. So for all of you, oops, it's gonna start playing, we don't wanna do that. You are required to conduct symptom screenings on staff before they come into work. And for staff, they are allowed to do some of the symptom screenings at home and call in before coming in, but you will need to do them on all the clients as they come in, or somehow, or wherever you would like them to do it, whether it's outside or inside, kind of up to you. But before services start, all of you are required to do symptom checks on clients as well. And on these pages and in our checklist, we link to, there is a log, a form that you can fill out, and I'll just show you where that is on here since we're in it. You can click on this log. It tells you all the things you need to ask about, and you can use the same form whether it's for staff or for clients. And one of the reasons they want you to do it on clients is if there happens to be an outbreak where your facility may have been one of the sites where someone who tested positive either came into, this will help them be able to follow up with the other people who were maybe in the facility around the same time. So that's the reason why they're doing it. And let me see if there's just any other. I think the other page I wanted to show you, if I can find it up here, is this one. On the Safer at Home, again, website, the FAQ also has a lot of wonderful resources where kind of a lot of the common questions that we've been funneling up to the state and the state has been getting directly, they haven't necessarily updated on the personal services requirements page. They've been putting answers here within this general FAQ. So you might want to take some time to come to this FAQ and search through and find what might be relevant to your specific question. I know for some of you, there has been quite a few questions around personal training and what isn't allowed and isn't allowed. And I'll just recommend right now, for a lot of you, coming to this local and personal recreation section might answer a lot of the questions that you're interested in right now. So I'm going to pop back to the slideshow. Oops, it started over. Sorry about that. Let me get back to where we were. So just to, since we showed you the checklist, I just want to go over that. The checklist is really just a tool to help you be compliant with the requirements at the statewide level. We will, if we get any calls or concerns, since there's a public call center and an email that the public can let us know if they think businesses are not being compliant. What we'll do is we'll call and inquire first, and we'll do some education and just make sure you're aware of what you need to be doing first. So if you hear from us, don't necessarily think it's a bad thing. We're trying to help everybody be compliant. If issues continue, we may ask to go through that checklist with you and ask for verification that you are doing each of the items on the checklist. And then it could potentially escalate to the point where you might receive an order to close or some sort of other civil action as possible. So that's why we're really asking for volunteer compliance, and we created those checklists as a way to make it as simple as possible for you all to comply. And then this is really meant, the slide is we can't provide legal advice, is that we were really inundated, which was wonderful, and we asked for it, and you all responded with, tell us what your needs are and what your concerns are, and you all delivered big time. We got a lot of calls and a lot of emails about what you all needed, and to be honest, it sort of overwhelmed our system, our capacity. So one of the things that we're trying to get the word out is that we are here to help give guidance and clarity around the checklist and the stay-at-home orders, but if you really need nitty-gritty detailed answers about what you're doing or how you're going to do it, we're going to probably recommend talking to your own attorney, as well as that our attorneys and our team doesn't have the capacity, because we left a lot of you probably unanswered this week unintentionally, because we were just so many questions out there. So hopefully that makes sense. So what I tried to do was go through, and here were the most common questions we got and answers that we got this week. So let's go through those. Is that many questions around pool and gym use, and just the simplest way to say it is that both facility types remain closed. And here I linked to the Safer at Home FAQ and that local and recreation page on the state sites. I won't go to them now, but those are both available, where you can find a lot of information on what is still open and what isn't. And connected to pool and gym use is personal training. So one of the things we got clarity on this week was the definition of, definition of what personal training and 4 people meant, a total of 4 people. That really is 1 trainer and 3 clients total. And the caveat is, if you have a family who you're training and they're from the same household and they have 5 or 6 members, you can train a family from a single household if it's above 3. But if it's clients who are coming from different households, it's 1 trainer to 3 clients. That's the max that you're allowed to train at any one time. Can you use a gym for personal training? Just to make sure it's clear, gyms are to remain closed. No gyms are open for public use. Though there has been the exemption that says that yes, a gym can be used for personal training purposes only, even though the gym remains closed, but you must comply with all the other relevant stay-at-home requirements. Pool use, there was confusion this week where there was a set of orders that went out and then it was taken back, and we got clarity from the state as well as other surrounding counties that say at this point in time, no to personal training in a pool, and you can find more information there on the state Safer at Home FAQ. Shared spaces, especially for the salons and the salon suites out there, was definitely a big question and a hot topic this last week, and all the different space layouts you all are contending with. Very good questions. All of those were obviously relayed upwards, and it was a common question across the state, and a lot of you got this guidance pretty much at the same time that we put out our last guidance as well, which was conflicting. So we quickly tried to revert our local guidance to sync up with this guidance that now says that there are ways for suite spaces. If you have more than 1 business or more than 1 operator in a business, if they have 4 walls around them, you can treat each one of those spaces individually, as long as each space follows the requirements needed for personal services. And you can find all of those details in Dora's latest guidance under, and it's dated May 5th, or excuse me, May 7th. But this guidance is also on our Boulder County website page under personal services. So we're trying to make this as easy as possible for you to find information. And then the other question is, where can I find the personal services or requirements? We went over that a little bit. I'll just review here. If you go to bouldercounty.org and you click on COVID-19, and in that green drop-down box, you'll get to this businesses page where we have all of the checklist information. This second website here will take you straight to the state site, which we have compiled for you in our checklists. And other sources would be the Chamber of Commerce, Small Business Development Centers, your industry associations, your licensing agencies, your local municipalities. They as well will also have additional guidance or possibly best practice ideas for you all on how to be as compliant as possible with the state's Safer at Home order. And I think we're wrapping up here, but just to reiterate, we're going to start holding these office hours, which I think is a great way to talk about these sessions, every Tuesday and Thursday. So depending on which industry you're interested in, you might want to put these reoccurring webinars on there, and we're going to try to address, like I did today, start to what were the most common questions coming up, and then sharing resources, and hopefully future get more a way to share best practices amongst the groups a little bit more than just being talked at. But just to remind you all, I know a number of you might also want to attend either the retail sessions, the limited healthcare sessions, possibly the office sessions. Just based on the nature of your businesses, you might have more than one set of requirements to follow. So consider looking into these other sectors that might be applicable to you as well. And I believe our Spanish session on Wednesday this week is delayed, but that will be on Wednesdays moving forward. Do I have that correct?
It will be, we are not going to have one this week, but we'll have another Spanish session next week.
The following.
We do the following week. It may move to either a Tuesday or Thursday, so we'll get that information out. We have a recorded video of this information in Spanish, cross industry, that is available if anybody would like to watch it at this time.
And great, and just want to plug that where you can find all of this information. Obviously we have some links here, but the Boulder Chamber has been the lead on setting all of these up, and they have a wonderful events and current happenings page where you can find all the details of not only these sessions, but other sessions that they're hosting that might be helpful to local businesses. So shout out to Boulder Chamber and all of their chamber partners for setting up all these wonderful resources for the local community. And with that, we'll kind of open it for questions and suggestions, and I'll just remind everybody, this covidbiz@bouldercounty.org, that's where you can email us. You can also call the call center. The number is listed there, and they get funneled to our team, and then our team tries to answer all of the questions we get as quickly as possible. And again, I'll just apologize. I know I did not get back to all of you. I had a number of team members help me try to get through the personal services calls and emails this week. There were just so many. So if you didn't get responded to directly, we tried to make sure we answered your questions in the common question and answer section here in this session. But if we missed you, we're still trying to get through that list as well. So we should be getting to you soon. But we're just trying to get through all of those as quickly as possible.
Thank you, Cami. I have actually quite a few questions about body art and piercing.
Okay.
Could you go in a little bit more detail about what PPE a body artist might have to wear?
Yeah, and actually, I know we also have a point person for body art within Boulder County. Lane, do you have, I don't know if you ever email, or what we can do, Corinne, how about this? Her name's Melissa. I know we can connect a lot of the body art folks. We'll put that out as one of the resources as a response, but we do have a point person for that. But in general, they need to follow what's in the checklist that we already have outlined as far as the general requirements, as well as specific to personal services. They'll need to follow all of those guidelines, but there may be more that Melissa might be able to help them with specifically.
And I can answer that too. So the body artists need to wear a face covering mask. It does not need to be a respirator or a surgical mask. And similarly, their clients need to have a mask on at all times as well. So they cannot remove the mask. I saw another question about, can they remove it to do a piercing of, say, the nose or something? You cannot.
I think in general, any services like the facials or waxing or anything that's anywhere near the face or the mouth is why they're saying mask required. It's just one of those limited services that's just not going to be allowed right now. Anything off the face or higher up on the face, like eyebrows or anything, but anything near the mouth or nose, masks cannot come off to perform those type of services.
Okay, and as far as the PPE, they should look at the personal services, and then we'll send some contact information from further information about body art to them. Lane, here's a question for you. I think people have started to hear the governor talk about May 26th. What does that date mean? What are some of the things that may happen around that time?
So that's the next target. That's when the safer at home order is currently set to go through. So the governor will be reevaluating what, if any, changes are going to be made. We don't have any information at this time. We've heard him talk about campgrounds. We've heard him talk about restaurants, but we don't have any specificity of what the state is thinking about relaxing further orders. It also is going to be very dependent on what's happening with our healthcare system, the surveillance data, what kind of hospitalization rates we're having. Largely, it's going to be very dependent on how effective this current safer at home is, how well people comply with the various orders. If we see a lot of disease transmission happening in the next few weeks, it's very unlikely that we will see further relaxations, and depending on how bad, it could force things to go backwards. So it's really important that the community and the businesses do a really good job of protecting and preventing further transmission.
Okay. Cam, you did a great job of preemptively answering some of the questions that were answered on previous webinars today. But could you talk a little bit about the conversation you have with people that refuse to wear masks? You know, that conversation tree.
Question. Yeah.
And where it goes and how you deal with people that will not wear masks.
Yeah. So for personal services and for limited healthcare settings, it's just a very strict requirement that staff and clients, or staff and customers, depending on how you refer to the public coming in, have to wear masks to receive services unless they qualify for one of those exemptions. And so let me show everybody.
And let me just preempt that. I don't think there are any exemptions for those two services. The exemptions are to our mask order, which is talking about people in the general public wearing masks, but there are no exemptions that I've seen for the state safer at home for these two sectors. So that's where I think people get conflicted, is there's exemptions for children that are 12 and under for our local mask order, but there is no exemption for 12 and under for personal services or limited healthcare services. So if they are not able to wear a mask, they're not able to get the service.
Yeah.
So we got a couple questions this week, which are, if a person's not able to wear a mask, you know, we can say we can't provide the service at this time.
Oh, I know a lot of places when they're doing their online scheduling right now, or when they're talking to them on the phone, they're having those conversations to make sure that before you come in, you have the conversation about bringing, you know, can you bring a mask? And if you can't right now, let's maybe reschedule for a later time. You are allowed to give clients a mask if you have enough PPE available. I know a lot of places are struggling just to get enough for themselves, so I'm not assuming that businesses will have enough to give out, but if you do, you can give unused, disposable, one-time use only masks to clients if that is a resource you have available to you. But I also wanted to show on our website as well, under some of those supporting documents, we do have a flow sheet, kind of like a script available for how to have those conversations about face coverings. And so it's really just whatever your standard welcome is, and kind of based, and then the question is, do you have a face covering available? Which again, a lot of this might be avoided depending on when you're doing your appointment booking, that you can have this conversation then, just so they know they need to come in, or they won't be so maybe surprised if you end up saying, I'm sorry, but we need to reschedule because you didn't bring your mask in. But based on their yes or no answer to whether they have a mask available, you can sort of follow the flow chart through to the right based on, and we give some talking points. And ultimately, you cannot provide services if they don't have a mask. And if things escalate, which we don't hope it escalates, and we don't want you to end up having to have confrontational conversations, again, be as preventative as possible, is that your local law enforcement would be your best resource to call upon in the moment if someone, for some reason ends up causing a problem for you at your business.
Lane, you're on mute.
This is one of the sectors where that, you know, we built this for all the sectors as a more generic tool, but the limited healthcare and the personal services, do not allow for people that have a medical reason that they can't wear a mask to then get services. So that's not an acceptable reason to then still give them services.
I know for massage therapists, we answered some questions between the limited personal services and this one about, being in the face mask with the head down with the head covering has been difficult, but yes, they still need to wear their face mask if you're going to be doing that services. So for some folks, maybe not limiting services on the stomach side. And kids definitely 12 and under, to get a haircut or whatever, whether it's chiropractic care, whatever, they would still need to have a face covering on to receive those services.
Okay, you answered this in the presentation, but there was a question about it. The salon suites, Boulder County is following the DORA guidance that went out.
Yes, and we do apologize for the confusion because the same day, almost probably felt like the same minute they sent out their guidance, we had sent out guidance that said, because we hadn't heard from the state yet, that it was only 10 people in a building, regardless of how big you were or regardless of what your space setup was like. DORA put out guidance that clarified that. So we tried to follow up as quickly as possible afterwards. It says, Boulder County, we take back our previous guidance that says 10 only. Please now follow the DORA guidelines, which talks about the different space setups, including what suites can do that have multiple spaces within a space.
Okay. The next question is about eye protection. I think it's a two-part question. It's more, are there requirements for eye protection? And then maybe what are some best practices for some eye protection in personal services?
That's a good question. I am unaware of any specifics other than what Lane mentioned about the body art, where they might need to have the face shield, which covers eyes, but there's nothing specific in the current safer at home orders that talks about specific eye protection. So if that's something that is industry specific, that might be what this person is referring to, then they would want to follow whatever their industry specific guidelines are around that. But there's nothing specific in this safer at home orders for businesses in this sector about eye protection.
Okay. Brings up a common question, which is, if I get guidance from DORA and I get guidance from the county and I get guidance from the state, what do I follow?
Great question. And I think the simplest way to say it is follow what is the strictest, most restrictive, the safest, what will provide the most safety. So you go with the stricter order. And at the county, what we're trying to do too is to compile all the state's information into one place, not necessarily have multiple competing orders on top of each other. That makes it confusing. But you would go with the stricter order in all cases, as that would provide the most safety and protection.
Okay. Can patients who can't wear a mask wear a face shield during services instead?
No. So a face shield is intended to protect the person wearing the shield, usually protecting their eyes, their mucous membranes, typically from something that's happening in the procedure. So a body artist maybe wears that to avoid splatter from a person that they're performing a service on. It does not protect anyone else from droplets coming out of the person's mouth. So it's not serving the function of preventing droplets from the person who's wearing the face covering. So a face shield is a different type of protection for a very different reason.
So what's the process to be followed if a client calls and reports testing positive after the service?
That's a good question too. I know there's guidance. I was going to pop back to it on the webpage too, about connecting with public health. There's a team of epidemiologists and there's guidance about what to do when there's so Lane, I'm going to look for that. If you want to answer too, I'm going to pull that up.
Sure.
Real quick.
So specifically, if there's 2 or more cases linked to a business, that's something that requires reporting to public health. If you just get anecdotal report, someone that has been at your practice and, for whatever period of time prior that's now sick, that doesn't necessitate that it's linked directly to you, and it doesn't mean that it's an outbreak at this point. But if there are 2 or more, we do need that reported so we can investigate. If it's workers, I think that's where you need to take precautions. If it was a worker that is reporting it, you need to make sure that they are following all those proper procedures and that you address quarantine and isolation as appropriate for anybody that's exposed.
So if it's a client, a customer in a body art or at a hairdresser who calls back and says, I now have tested positive for COVID-19, are there any steps you need to go through yourself as the personal services provider to protect yourself or quarantine or any of that stuff?
It really is very dependent on a lot of pieces of when did they test positive, when were they in your facility. So would they have been potentially symptomatic when they saw you? So certainly if that occurs, you can reach out to us and we can walk through those scenarios. It's certainly best for us to know, and we can help try to direct you of it. Are you at risk? Do we feel that you were exposed? Again, that's why these strict protocols are in place of making sure you've addressed, is the person ill? You've looked for fever symptoms as well as the other kind of symptoms of coughing and difficulty breathing, those kind of symptoms. They're going to wear a mask at all times to knock down droplets so that doesn't create another exposure for you. So it's all those protocols that need to happen to help prevent that risk. That being said, a face mask is not the same as a respirator, so it isn't that level of protection. So there is still some risk, which we understand that this safer at home is introducing additional risks in our community. But it's a compromise to allow businesses to start getting back and recognizing some income.
And I think that just reiterates the point why having the symptom monitoring logs will be so important. Because if we can trace back when that person was in your facility, if it is something that public health decides is a concern, they'll be able to then address it and come up with the right plan. So another reason to do those symptom checks and have your logs hold on them. But I just wanted to point out that on our website, in that same section where there's a bunch of other business resources, we do have guidance for what to do, and it would help walk through the process for a business of who and where and how and when to follow up, but we would also help you with that if you contacted us. But there is kind of step-by-step guidance on the website about what to do if you suspect an outbreak, like Lane said, where you have 2 known or suspected cases.
Okay, just 2 more questions in this realm. We've had personal service reach out and ask if they could take a client who is a doctor or nurse in a hospital who treats COVID patients. What's the recommendation there? And then what if they're a husband or spouse of a doctor or somebody who's on the front lines treating COVID patients?
I mean, there's no distinction of them as a client versus others. Certainly those occupations, we certainly don't want anyone getting ill, but there's no additional precautions that are required to perform a personal service on any of those folks. So you still need to follow all those other protocols. Again, for them, they need to think about, is this service something that they want to go get given the risks within the community still at this point?
I'm going to get to the pool question that's up, but I'm going to finish in this train of thought. When is a patient client allowed to come in for services after they've had COVID-19?
I think we have requirements spelled out for ill people sort of returning to work, and it would be very similar. So it's, there's.
And so does the state. I'm going to try to pull it up too.
There's a series of criteria. It's really looking at how long it's been since their symptom onset. And I believe it says at least 7 days post that. They also need to have their symptoms resolved so they no longer have a fever and they no longer have any of those other issues of difficulty breathing and cough.
I believe it might be 10 days, but yeah, Corinne, why don't we look for that and we can provide it back out too.
But
I think that there's just all these questions just reiterate too, while safer at home still means don't go out unless you have to. Is it really necessary? Just because you can doesn't mean you should, and that there's a lot of asymptomatic people out there, not just those who've been sort of on the front line. Should we be worried about? It's almost, any of us could be carrying it and be at risk to other people, and we just don't know it. So I think just to reiterate what the safer at home really means is stay at home and, you know, figure out what is necessary for you to go do versus just what's available for you to go do. You know, just personally
yeah.
considering that.
So, I mean, I think the person who asked the question earlier about, you know, how long about being told that a client tested positive, their example was if someone was seen yesterday for acupuncture, for example, has symptoms and tests positive today, how many days back do we need to contact other clients, or do they need to contact other clients?
If you're
You
following
wouldn't-
all the protocols, there shouldn't be a risk from patron to patron, because you're cleaning all of those locations and surfaces. You're not reusing any equipment between patrons. So you shouldn't be having transmission from one patient or one client to the next if you're following the protocols and doing all the cleaning that's necessary. The risk is more to you. Did you get exposed to that person while you were performing the service on them?
And there's definitely no expectation or requirement that you should be calling and letting clients know there was a positive test. I think that's where, if it rises to the level where our epidemiologists feel like it's an outbreak, they will provide that guidance. They will help with contact tracing and figuring out who needs to be called. But just because there's a positive with a client, you are under no expectation to start calling clients and providing them guidelines, or, you know, giving anyone else private personal health information about anyone else. So I think if that helps, let that expectation or thought go that you might need to do that. You would work with the epidemiologists if it rose to that level where that was needed, and they would guide you through the process.
Great. We have two questions on mask removal for drinking water and blowing your nose. Can a client who needs to take a drink of water or blow their nose take off the mask temporarily and then return it afterwards?
You know, there's obviously lots of nuances that are going to come up. The guidance is pretty strict that you cannot remove your mask. Certainly, if there's some emergency happening, you need to social distance so a person can go to a bathroom or something like that. The problem with them taking their masks on and off is that's a contamination step. When they take their mask off, you know, anything that's on that mask, they need to wash their hands and then putting the mask back on. So there's just additional risks there. So again, unless your procedures are incredibly long, you know, certainly a very large tattoo or something that's taking a really long time where you're going to need to take a break. If that's the case, I would encourage the people to have multiple masks or things like that so that they can leave, go to a bathroom, wash their hands after they take off their mask, you know, address whatever they need to address, put on another mask, and then be able to return. So there's no potential exposure between the person providing services and their client.
Okay, pools. Person's been waiting patiently. You said no pools. However, I thought I heard you say that you could be a trainer as long as under 3 people, if not from the same family.
Yeah. That was what we last week, we were under the impression that personal training could happen possibly at pools. It cannot. So let me go back to the slide. So pools cannot be open for any reason, and nor can personal training at pools happen at this point. That was a clarification from last week that we wanted to provide because we knew it was a different message than what had originally been given.
Yeah, it was really unfortunate. Last week we got communication from the state that said you could use pools indoor and outdoor for personal training.
Yeah.
And then yesterday we got guidance from the state saying there's no situation where a pool can be used for personal training or any other use. So it's really unfortunate, and we certainly apologize, but we're sort of at the whim of the state making those changes as well.
And just to clarify, it is inconsistent, or might feel inconsistent, is that gyms and pools absolutely are closed regardless of the type, regardless of whether it's indoor, outdoor, private, public, they're closed. But personal training gym space can be used. The gym is still closed, but they are allowed to do it. But swim private instruction is not. So that is a differentiation. And that's where it was a different message from last week, and we had to provide clarifying information this week.
And gym is very broad. So it's really any kind of athletic activity. So that can be a gym, that could be an ice rink, any of those
Yep.
functions. The one exception is a pool. So certainly we hope that the state continues to reflect on that and we see maybe additional guidance down the road. But unfortunately right now, those are all very strictly no pool uses of any kind.
So, yeah. So we recognize the pool folks and swim personal training folks. It did flip-flop, unfortunately, on us all. But right now, the answer is no services for pools or private swim instruction.
I think we have one more question, and then we can wrap up if there's no further questions. But if a client has a symptom on the checklist, like a sore throat, but no fever, can we ask them to leave?
If they say yes to any of those symptoms, they should be asked to reschedule. And there's guidance on that on this how to conduct the symptom checker page that we've linked to. It kind of spells out how to walk through all of that. So that's there. But basically any of the symptoms, it would be reschedule, err on the side of safety and reschedule.
Okay.
It's not just fever. Even though I think fever is talked about most commonly, it's not by any means more important or, somehow superseding the other symptoms that are on that checklist.
Yeah,
Right. I'm going to share. Oh, go ahead, Lane.
Is that people can use fever reducing medicines. And that's another distinction on when people can come back or be like an employee can be back, or the question about if you had a COVID patient, if they're still taking fever reducing medicines to keep their fever down, then they're still potentially contagious. So those are distinctions that you also would want to ask about when if they're honest about that and telling you they do have a sore throat, because there's no way for you to know if they do or don't. And they don't have a fever, you would ask, are you taking any medicines, any acetaminophen, ibuprofen, things like that.
So they clarified that the symptom checker says that you have to have 2 of the 3 main symptoms,
Yeah.
but the guidance is really if you have any of those.
Yeah, a sore throat alone doesn't necessarily mean you have COVID. There's a lot of things you can have, strep throat. There's plenty of illnesses that have that as a symptom, even just non-contagious diseases. But I think you're going to want to really be very cautious about somebody who's telling you some of the symptoms, and are they being honest about all of them, and are they taking medicines that would have masked some of the other symptoms.
So I'm going to quickly bring up my screen to show the signs, but while I'm doing that, Lane, do you want to talk a little bit about the feedback you're going to want from businesses on face coverings?
Yeah, in this sector, it isn't necessarily the target for our survey, but we would still like to send it to you because you really need to see 100% compliance with this. But we're really want to know what level of compliance are we seeing in our business community related to social distancing and people wearing face coverings. So again, our probably bigger target audiences are like retail and places that the clients should be wearing this and should be doing those, but they may or may not. So we're really interested in what level of compliance we're seeing and then also struggles that people are having with that. This is it's information that's going to help us understand, how effective are those orders being carried out, and then in combination with what are we seeing with disease. So ideally, the more effective people are at putting all these things in place, we should hopefully see our disease in a manageable level. But if people are not doing these things, people are not social distancing, not wearing masks, and our disease is increasing, that certainly would be a likely reason why.
Okay. And I had one more question come in via the chat. Did I understand you right? No facials until there is a vaccination?
There's no, if you're able to do a partial, you cannot remove the mask. So you certainly can perform any other services on the face outside of where the mask is. You just cannot move or remove the mask to do a procedure. So if you require a no mask to be present for the procedure you want to do, that at this time it cannot happen. And we're not sure when that will be allowed. Obviously, a lot of these procedures where you're in someone's breathing zone without personal protection, and a mask is really just going to knock down droplets, but a mask for the person performing it is not the same as a respirator. So some of these procedures have inherent risk. And so it's likely going to be a while before things are relaxed to allow that. Certainly we need to see sustained cases of the disease at manageable levels, are very robust testing. So we need to be identifying ideally all of the ill people within our communities. And then we need the staffing to follow up on all those trace investigations for who else has that ill person been in contact with, so we can get quarantine and isolation at an effective level. So those are all the big steps to really make sure this is effective.
And to clarify, because I got then 2 more questions about the same topic, you don't have an approximate date as to when facials will be able to be performed?
No.
Again, removal of the face coverings, I don't. I think the challenge, people have talked about, well, what if I was wearing a respirator? I'm then protected. The challenge is those supplies are just not there. You're now competing with people trying to save lives in a healthcare system. So again, we're not saying one person's job is more important, one livelihood is, but the use of that PPE is pretty critical. So at this point, the competition of those supplies is really challenging. It doesn't necessarily mean that we're waiting until a vaccine, but certainly at this point, we're going to need certainly further iterations of safer at home and beyond before we're going to see those types of procedures allowed.
And just to clarify, I'll just keep pointing people back to the DORA's update, because it explicitly says facials, are not allowed at this time because they cannot assure, a safe level of, service between, the client and the person providing the services. So the DORA update will kind of give some more information for those specifically interested in that service.
Okay, so let me just make sure we don't have any more questions, because we had like 3 pop up all of a sudden. What you're seeing on the screen right now are the sign resources sent to participants of these programs. They're linked to on Boulder County site, all the chamber sites, some of the municipality sites, and we have basically it's a drive of a bunch of signs that you can print in 8.5 by 11 and put up in your facility, including the must wear a mask, wash your hands in the bathroom, no convening, social distancing. We also have a sign, it's right here. It's open for business. It's your self-certification that you can print if you're following all the requirements of the checklist, to put it out for the public to see that you are following these requirements for both the public health and for our economy, so that we don't go backwards. Please take a look at these. All of these have been translated into Spanish as well. You do not have to provide the translation services. Those are available to you as well. We'll continue to send those out so that you don't have to create your own signs, find something from another state, or try to piece together some of this information. One last question came in that actually we had a lot of questions about, and then we'll close this out. Are there any restrictions to clients using restroom facilities? Some practitioners are disallowing restroom use, not restaurant.
Great. No, there's no specific guidance. Yes, restrooms can be open in your space. I think there's some best practices going on, and I did want to bring that up, so I'm glad you all brought it up, is just like everything else in the building, you're going to want to control for social distancing. So if you have a single bathroom, that might be a little bit easier, but if you have like a shared stall situation, you might want to consider closing certain stalls between others, so you can ensure if there is more than one person in there, they are able to maintain 6 feet distancing. The same thing with sinks. You might want to tape off a couple things, so when people are in there using the facilities, and then maybe have that they aren't too close to each other when they're cleaning their hands as well. You might want to put signage on the door that says no more than X number of people at a time, whatever it might be. So if you have a multi-stall situation, you still need to control for social distancing within that as well. And whether it's shared by staff and or clients, you just have to and then also ensure the frequent cleaning. So the social distancing and frequent cleaning have to be figured out for you to, use that bathroom during the day or make it available to your clientele as well. And if you don't have a restroom, it might be really nice just to let people know that ahead of time so they can come prepared, knowing that it's not going to be of use, and or make it clear why they're there. It's not available for use, as well if it's not a situation that is one you can effectively manage while you're managing everything else.
Thank you, Cammie. Thank you to Lane. Thank you to Jesse, who's kind of behind the scenes, for being available today and each week into the near future to answer these questions and to help businesses to open safely for our health and for our economy. We want to encourage you to keep having these dialogues. We'll provide opportunities for feedback in future sessions. They are weekly at 4 o'clock on Tuesdays. All that information is available on the Boulder Chamber site as well as some of the other chambers. On behalf of the chambers and economic development agencies in Boulder, I want to thank you for participating in some way and getting your questions answered in the best capacity we can. I hope everybody has a wonderful evening and stay healthy out there.
Thanks, Corinne.
Thank you. Thank you for helping organize.